Hello, dear students and esteemed learners. Welcome back. Welcome to my course on Sociology of Health. And now we are having our course for week 9, and that broader theme that we are covering this week is health of women and reproductive health. And in the previous lectures, we first tried to understand where do we find the issues related to health of women located, and then we try to understand what do we mean by reproductive health, and then what kind of strategic changes were brought by the ICPD conference and the Beijing conference, and how there are more strategic and empowered approaches to take care of the reproductive health of women are emerging. Now, this is lecture number 43, and the topic for today's presentation is maternal health and pregnancy care, concerns and achievements in India. So, we will talk about what do we understand by maternal health and what kind of care is required during pregnancy, why do we need to have this kind of care, and then what are the achievements in Indian context in last few decades. So the topics that I have included or the concepts that I have covered in this lecture are maternal death or maternal mortality, then the targets related to maternal health from the Millennium Development Goals and Sustainable Development Goals perspectives, then maternal mortality ratio, then few other indicators like birth attended by skilled health personnel, and then safe abortion and other related initiatives. The World Health Organization, in a report Women and Health, Today's Evidence, Tomorrow's Agenda, defines maternal health, and according to this definition, maternal health is the health of women during pregnancy, childbirth, and the postpartum period. So, there are different stages. One is the stage of pregnancy, the second is the stage of childbirth, and the third is the postpartum period, that means after the birth of the child. So, taking care of the women during these three stages is generally defined as or identified as the period of maternal health. While motherhood is often a positive and fulfilling experience, for too many women, it is associated with suffering, ill health, and even death. And because of that kind of suffering and ill health and the most unfortunate situation of death, the issues related to maternal health become very important and matter of concern for the policymakers as well as the academicians. Throughout human history, pregnancy and childbearing have caused death and disability both among women and neonatal. However, with the advancement of human understanding about the processes and with the availability of good number of interventions, now in the contemporary age, there is an effort to mitigate these premature mortalities. Pregnancy and childbirth are, of course, not disease. WHO is also saying this. But they carry risks because of the varying and embedded complications, practices, processes, beliefs, life conditions, and the immediate environment. Because the birth takes place in the social environment, it involves and engages people who may be trained or may not be trained. Historically, this process was actually supervised by, guided by, and supported by people who were not having any technical understanding or specific scientific understanding. But now, with the growth of scientific understanding of the process of birth and the kind of social determinants which may influence the process, these processes are basically becoming safer, and maternal health is basically an effort in that direction. These risks can be reduced by healthcare interventions such as the provision of maternal and public health care, antenatal and postnatal care, supplementary nutrition, family planning, safe abortion, and improvement in other reproductive conditions. So we have been talking about these conditions in last two lectures, and now we will try to understand how these concepts are specifically applicable in these conditions. So one very important term that we need to understand and define is maternal death. According to World Health Organization's International Classification of Disease and Related Health Problems, maternal death could be defined as the death of a woman while pregnant or within 42 days of termination of pregnancy. So it's a specific time period. Death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. That means when a death is caused during pregnancy or after 42 days of termination of pregnancy, death would be identified as a maternal death if it is not caused by some accidental or something which is not related anyway to the pregnancy or the childbirth. So this is the definition of maternal death, and on that very basis basically maternal mortality is also calculated. Now there are Millennium Development Goals and Sustainable Development Goals related to reducing maternal mortality. We talked about the MDGs and SDGs in previous classes, and there we referred to this, but here we will talk about the specific indicators and try to understand the achievements also. Now, improving maternal health is one of the 3 health related goals out of the 8 Millennium Development Goals that we have already studied and understood. Now, out of these 3, the goal 5 is basically talking about the maternal mortalities, and there is a very specific goal and related targets. Under goal 5 of the MDGs, countries are committed to lowering maternal mortality between 1990 and 2015 by 3 quarters. So, as we have discussed before also, there are qualitative goals, but these goals are getting converted into quantitative goals. So, in 1990, whatever number was existing, by 2015, that number should be reduced to 3 quarter. So, this is how this goal is relative for every country or contextual for every country. In September 2015, the UN's adoption of the Sustainable Development Goals reconfirmed the elimination of maternal and infant mortality as global targets in the decades to come. That means we are consistently seeing that the global agencies are showing their concern and actually encouraging the nation states to take immediate steps so that this maternal mortality should be reduced, because this is very important for the survival of humanity in this universe. Now, what are those goals? So, there are target 5.A and target 5.B. 5.A says that reduce by 3 quarters between 1990 and 2015 the maternal mortality ratio. And then there are indicators like maternal mortality ratio and then proportion of birth attended by skilled health personnel. Because this proportion of birth attended by skilled health professional is a very important in mitigating the maternal mortality, because that provides trained care during the process of birth. And then there is target 5.b, and which says that achieve by 2015 universal access to reproductive health. And the indicators are contraceptive prevalence rate, adolescent birth rate, antenatal care coverage, and unmet need for family planning. So these are the broader indicators related to the specific targets. Now, when we want to assess the progress made, we want to see, or we need to see, the progress made in these specific directions. And in the rest of the slides, basically, we will try to see and assess the progress made in each of these areas. So the first and the most important basically target or goal is to reduce maternal mortality ratio. And now here is an acknowledgement, because we need very specific data for making an assessment or evaluation or for understanding the progress made. I have taken the data from official document, basically the Millennium Development Goals Final Country Report of India, which is a Government of India publication, and it got published in 2017. So all these figures and data have been taken from that, and this report is available in the website of Government of India in the open access domain, and I have mentioned the link of that also. So the target is reduced by 3/4 between 1990 and 2015 the maternal mortality rate. Now we will see how this is basically progressing. So first of all, the maternal mortality ratio need to be defined. The maternal mortality ratio is the number of women who die from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes during pregnancy and childbirth, or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, per 100,000 live births. So, the first part of this definition is basically talking about maternal death. So, you can say that maternal mortality ratio means maternal death per 100,000 live births. And that is why basically we make use of the term ratio. So when we talk about maternal mortality, then it is maternal mortality ratio. Very often we talk about a rate also, but in that sense, we need to specify that, because few decades back, there was use of the term rate, but that was calculated per 1,000 population, right? You may remember at certain places we have referred to that. Primarily when we were talking about the Bore committee report, and we were making an assessment related to that. But now at the international level, the popular term is maternal mortality ratio, and it talks about maternal death per 100,000 live birth. Such deaths are affected by various factors, including general health status, education, services during the pregnancy and childbirth. So there are few things which needs a very comprehensive approach. For example, education or health status, etc. And for that, a long-term plan and effort is required. So the nation states are making effort in that direction. But at the same time, there are certain things which are required during that specific period. And basically, this maternity care or antenatal and postnatal care, or basically the kind of services which are required during the birth of the child, those become very important, because if those are not handled appropriately and scientifically, then that may give adverse effect. So most maternal deaths are avoidable, and this target talks about it. Primarily, maternal deaths are avoidable because whenever a maternal death is taking place, it's taking place because of certain reason, and if that reason could have been avoided, that death could have been avoided. And that is why this goal is becoming so important. Now, let us try to have a look on the situation of India. In India, pregnancy related death of women have declined over the years. The number of maternal deaths per year has come down from approximately 100,000 deaths in 1991 to 01 to 44,000 deaths in 2011 to 13. So, this is a good decline, though more than 50% reduction has registered in the approximate number of maternal deaths in the last 2 decades. The present status shows that even now many women die of causes associated with pregnancy in India. So, although there is reduction in the prevalence or causation, but despite that reduction, the status is problematic. The numbers are still challenging, and that is why more focused effort is still required. The MDG 5 stipulates that MMR level be reduced by 3/4 between 1990 and 2015. In 1990, the estimated MMR was 437 per 100,000 live births. In order to meet the MDG target, the MMR should be reduced to 109 per 100,000 live births by 2015. Now, as per the latest Office of the Registrar General data, the MMR status at all India level is at 167 in 2011-13. So, there are basically one discrepancy also here, that the latest figures available is basically talking about the time period 2011-13. So, information is not available for the time period 2015 because the information is collected periodically, and so some kind of gap is often occurring. However, we can say that although some advancement is made, but still the target is far away. Then, if we try to see the situation prevailing in some of the states, we can see that among the major states, the MMR ranges from 61 in Kerala to 300 in Assam in 2011-13. That means there is a huge disparity between the states. In Kerala, it's around 60, and in Assam, it was 300. That means a huge difference of more than 5 times. And just like that, there are other states like Bihar, Jharkhand, where the prevalence was 208. Then Madhya Pradesh, Chhattisgarh, 221, Odisha, 222, Rajasthan, 244, Uttar Pradesh, Uttarakhand, 285, and Assam, 300. However, the silver lining is this, that the prevalence at the national level is 167. So, much better than some of these states which have not performed well. And that basically shows that there is interstate disparity. And so, we will talk about the interstate disparities also in one of the lectures. And there we will have a more comprehensive look among the specific states, and also try to see what kind of disparity is existing between the rural and urban areas, because that is where this disparity is actually coming into existence. That is a very serious problem. Then, proportion of birth attended by skilled health personnel, that is very important, because the skilled health personnel know how to handle the situation, and if required, what kind of surgical interventions could be made or asked for, right? So, the presence of the the presence of the skilled health personnel is very important during the process of birth. Now, why this is becoming so important in Indian context? Because in India, the practice of child delivery at home is very much prevailing. It was very much prevailing. Now, this is actually getting reduced. So, historically, the childbirth basically took place at homes, and there were traditional dais who used to be the elderly women who may have some kind of experience in handling those situations without any skill or without any scientific intervention, and more importantly without any equipment. So the most important thing here is this, that during the process of birth we need the sterilized equipments also, and unfortunately when the birth is taking place at home, then neither that medical environment is there and nor that medical mindset is there. So that is creating a good number of technical issues which often go against the child or the mother. In order to reduce maternal mortality and infant mortality, it is extremely important that all birth be attended by skilled health personnel, as timely management and treatment can make the difference between life and death. So, skilled personnel are very important because they know what to do under which situations. The skilled health personnel include only those who are properly trained and who have appropriate equipment and drugs. That is very important actually. Very often we make use of the word the trained dies. No, the dies or the lady, the elderly lady who is taking care of, she is also claiming herself as a trained person, but basically the training is not scientific, not given in a medical environment, not supported by the necessary medical equipments, and very importantly not supported by the medical drugs or medicines. So these are the important situations, and so this basically indicator is becoming very important. Then proportion of birth attended by skilled health personnel. In this direction, we can further state that the states of Kerala, Lakshadweep, and Puducherry have achieved 100% coverage in birth attended by skilled health personnel in 2015-16 as per the NFHS 4 report. Now, 13 states reported that more than 90% of the birth were attended by skilled health personnel. So, these are basically very encouraging figures as reported by the National Family Health Survey 15-16. This report basically got published in 2017. So later on we get the additional information. Then one important indicator is basically condom use rate of the contraceptive prevalence rate. Basically there are two things. One is the making use of the contraceptives, and so the contraceptive prevalence rate is calculated, and within that basically use of condoms, right? So there can be different types of contraceptives. One very popular type of contraceptive is basically the IUD inserts, right? Or there can be contraceptive pills, right? But these methods although can serve the purpose related to contraceptive, that is the controlling the unwanted pregnancy, but there are other important things which are not fulfilled by this, and for that basically the condoms are recommended. Because when we look at the thing from the perspective of HIV AIDS, then that actually takes place through during the sexual intercourses, and the condoms can stop the communication of the HIV AIDS, and that is why this indicator is developed, and that is becoming very important. So contraceptives can serve the purpose of population control, and that is why those become very popular in the decades of 70s and early 80s. But later on, with the onslaught of HIV AIDS, there is change in the strategy, and that is why we need to talk about this. So according to NFHS 4 in 2015-16, the condom use rate of the contraceptive prevalence rate is only 5.6% at all India level, vis-a-vis 5.2% in 2005-6. That means there is no progress in that number. That means people are still not have adopted the behavior. So the behavior change is becoming an important thing, and the prevalence rate is actually very important because that shows the vulnerability towards the sexually transmissible infections, including HIV/AIDS. Then this condom use rate of the contraceptive prevalence rate is highest in Chandigarh, that is 27.3%, followed by Delhi 19%, Punjab 18.9%, and Uttarakhand 16.1%. And the lowest in states like Andhra Pradesh 0.2%, followed by Telangana 0.5%, Puducherry 0.8%, Tamil Nadu 0.8%. So we can see that there is huge gap in terms of prevalence rate in the major states. The major cities basically do have better prevalence rate, but at a larger level this prevalence is very low. That means the threat related to the transmission of HIV/AIDS and other STIs is still very high. Then next indicator is proportion of population aged 15 to 24 years with comprehensive correct knowledge of HIV/AIDS, right? So basically when this use of condom is so restricted, then comes another important question, and which is related to whether people have some kind of knowledge about this or not. And so this important indicator, and the NFHS 4 figures show that in 2015-16 the percentage of youth in the age group 15 to 24 who have comprehensive knowledge of HIV/AIDS is 26.5%, and the awareness among males is higher than that of the females. That means the overall awareness or knowledge itself is very low, that is 26.5%. So if people are not even aware of the need of this, then how can they will go for the behavior change? And so we can realize that there is a need of making people aware of the situation, that is one, then changing their behavior, that's two, and then making an environment where they should be free from the threat of the communication of STI or HIV/AIDS. All these things are important components, and that is why awareness is very important. And so at academic level, we are talking about these points also at length. Then comes a very important indicator that is related to the consumption of iron and folic acid supplementation during pregnancy and lactating period, right? So we all know that during pregnancy, basically iron and folic acid are very much required because of the growth of the fetus inside the body of the women, right? And there is an additional need requirement for that. And so within the antenatal care, there is a provision of providing these extra supplementary doses. After the first trimester of pregnancy, every pregnant woman during ANC is also given iron and folic acid tablets for 6 months after the first trimester of pregnancy and 6 months postpartum, right? So before the birth of the child and also after the birth of the child, so that before the birth of the child, so that the child in the form of the fetus should get that, and after the birth of the child, so that the newborn baby should get that from the milk of the breast milk of the mother, right? So that this nutritional deficiency should be addressed. Now these things are basically talking about how we can mitigate the problems caused by nutritional deficiency. Then a very important thing basically that is related to the unsafe abortion, because women often go for unsafe abortion when they want to terminate the unwanted pregnancies. So abortion is basically protected by law. However, because of the social and the cultural practices and stigma related to that, very often women and families go for unsafe abortion, and that very often endanger their life and their reproductive behavior also. And so it is realized that there is a need of comprehensive abortion care, and the government basically are taking care that the doctors should have appropriate understanding about this comprehensive abortion care, and for this some arrangements have also been made so that the abortions could be made safe. So these were some of the achievements made in the specific direction, and I have included one thing about this problem, an activity question, and have a look on that. So with this, we come to an end of this lecture. However, there are issues that we still need to discuss, and one important issue is basically related to the disparities among the states and the disparity existing between rural and urban areas. And for that, and we will cover these things in the next lecture. So we will meet in the next lecture, and till then, take care.